A new imaging technology called real-time 3D scanning makes it faster and easier for the medical team to capture precise measurements, which leads to better outcomes and faster recovery for patients. We spoke to Dr. David Duffner at Desert Regional Medical Center in Palm Springs and asked him, what is 3D scanning?
3D scanning is kind of shorthand for three-dimensional image capture. And the way that it's done with the technique that we're using now is that we have a machine called a fluoroscopy machine, which is an X-ray tube, and there's actually two of them that are mounted 90 degrees to each other. It's shaped like an O, but the O opens up. So we can, after the patient is asleep on the operating table, we can move the machine into position, and then the O closes, and we have a sterile covering that covers the entire machine. And then the two X-ray tubes are inside the machine, and the technician gets two views, an AP and a lateral view, to center the anatomy that we're interested in. We center it inside the O, if you will, and then they activate the rotation. We call it the spin. So it spins 360 degrees, and it takes 21 seconds to take 192 X-rays. And then all of those images are processed through a computer, and the computer generates a three-dimensional model of the anatomy. Before we capture the image, we have to have a marker on the patient. So we attach this small device through this post. There's a pin that is placed inside a bony landmark. So for the pelvis or the spine, it would be the posterior pelvis where, right about at your belt level, you can kind of feel that bone there. So we put a pin into that bone and attach this frame to that pin. So when the machine spins, it knows where these reflector balls are, and then the computer knows where all of the bony anatomy is, where the skeleton is, in reference to these four balls. Then we can bring a tool into the field. This is simply a pointer, but we can also have other tools such as a drill for a bone screw, or the tap, or the actual screw itself, or different types of implants, such as a disc replacement implant. We can bring them into the field, and with these reflectors, the position is captured by a infrared camera. It's a double lens camera. So it knows where this is in relationship to this, and it knows where all the anatomy is relative to this. So therefore, the computer tells us where this is pointing. So we know exactly where to make a small incision, and that allows us to insert tools and devices, implants, screws, or spacers, through much smaller incisions and much more precisely. The neurosurgeons and ENT and maxillofacial or cranial surgeons, they can also use it for head anatomy. But in my practice as an orthopedic surgeon, I use it for spine and pelvic procedures. This technology allows us to do much more precise surgery through smaller incisions, and it saves time. Plus, with smaller incisions and smaller exposures, there's a lot less blood loss, a lot less tissue trauma from the operation itself. So it's just, it's a fantastic improvement, and it benefits surgery in every aspect. Because it's minimally invasive, very small incisions, just enough to put the device in, there's very little post-operative pain. So it's a win-win all the way around.